Hey guys, I'm going to do this video where I'll highlight some things on the shoulder complex as well as the elbow. This is not an all-inclusive video as to everything you need to review for the exam coming up, but I do hope that it should direct your studies into the type of areas that you need to focus on. I want to start by going back to the basics here, anatomical position. And remember, in anatomical position, the palms are facing forward, so the thumbs are out to the lateral aspect. So in this position, just to visualize the bones in here, we're talking the upper extremity, we've got the humerus that would be part of the arm here, and when we go to the forearm, the radius would be towards the lateral aspect, or on the thumb side, and the ulna is the one that would be more medial. Going back to some other visuals, you guys know I love this picture. I think this just does a great job of highlighting all the ligamentous of the shoulder, specifically the glenohumeral joint, but then we also see the AC joint or the acromioclavicular joint up there. And again, a couple of structures that we talked about that are not specifically highlighted on this. Again, we're looking at an anterior or the front-on view of this right shoulder, and we've got this joint capsule right here, thick band of fibers, and under the joint capsule, and this would be the glenohumeral joint, the glenoid fossa of the scapula, and the humeral head where they articulate, so this is the ball and socket joint of the shoulder. And under that glenohumeral joint capsule, we have three anterior glenohumeral ligaments: the superior, middle, and inferior glenohumeral ligaments. So important to remember that even though they're not shown on this particular picture, they are there, and they do serve an important function in preventing that anterior translation or an anterior dislocation of the humeral head. Remember, this is such an unstable joint. It's like a golf ball in a tee. If we didn't have all this ligamentous structure and all the musculostructure, specifically the rotator cuff, this would just be an unbelievably unstable joint to the point that we wouldn't be able to use our shoulders at all. The coracohumeral, so coracoid process right here of the scapula, and humerus, so this ligament right there in the deeper red, that also serves a function of stability. It's keeping that humeral head down so it doesn't let it travel to superior motion there. Remember the coracoacromial, coracoid process, acromium here. Coracoacromial ligament is not our typical ligament that attaches two bones together that are part of two different bones, So both of these are part of the scapula. If we cut that coracoacromial ligament, that scapula is going to function just like it always does. It's not going to make it any more unstable because it's a bony stability already. However, you can see cut right here is the supraspinatus tendon. This will be your subscapularis tendon cut down here, but the supraspinatus actually goes under that ligament and then will attach on the back on that superior part just above the spinous process on the back of the scapula. So it serves an important part, just keeping that down there. Some other structures we don't see here, if we layer on, we have a bursa, the subacromial. So we've got the acromium here below, so subacromial bursa. So it's right in here, and we also would layer on the deltoid ligament, deltoid muscles, the anterior, middle, and posterior deltoid muscles that kind of drape over that shoulder and attach down. Remember, about mid-shaft on the humerus, we have that little tuberosity called the deltoid tuberosity. Important one to remember, guys. Deltoid tuberosity right down there, where they attach down there. Some other structures we see, and remember the subacromial bursa, very important in that area. The biceps brachii tendon, remember bicep or bi has two heads. Here's that long head coming up, going under, and we don't see it, but it will wrap around deep to all this joint capsule and actually attaches at that superior aspect of the glenoid labrum. And the short head of the bicep brachii, also not pictured here, but would come up and attach right there on that coracoid process. All important structures. Remember that here's the clavicle coming over, the acromioclavicular ligament, which really is the main stabilizing ligament for the acromioclavicular joint. And if that was disrupted, you would know that that distal end of the clavicle could pop up or travel superiorly. And one of the clinical tests that we covered in class is called the piano key, whereas if somebody took their finger right there on the edge, middle to distal part of the clavicle and pushed down, we'd actually see it depress, and then as they lifted their finger off, it would rebound just like a piano key would. So a disruption of the acromioclavicular ligament, also called an AC joint sprain, would be one where that's not functioning properly. So we've seen this image that I love so much. Don't forget again, really deep to this. So under the joint capsule, under those anterior glenohumeral ligaments, we do have the glenoid fossa and the glenoid labrum. Remember, the labrum functions to deepen that socket of the glenohumeral joint. I talked about the ball and socket joint. Remember that glenoid surface is very small as compared to the size of the humeral head, and it's relatively flat, meaning that the humeral head could slide around a lot on it. So the glenoid labrum functions to deepen that socket, so there's more of a structure and more boundaries for it to travel in. I'm going to close this one out. This picture I also really, really like. We didn't cover this a lot in class today, but this is in your trail guide. I think it is page 160 is what it's saying down here, but we'll take a look at that. But take a look at this because it just does a nice job of showing the bony and ligamentous anatomy of the elbow. So again, we've got our humerus coming down here. It's our distal end of the humerus. This bone right here is the ulna, and the very tip of the ulna is the olecranon process. What we do not see pictured here is the olecranon bursa. It sits right out here. And the tricep muscle comes down, turns to the tricep tendon, also attaches right there. So important structures with that. This is on the right-hand side is the medial view of the right elbow, or the inside view. And we can see that we have, again, our ulna here. We have our medial epicondyle. That's that really bony prominence on the distal end of the humerus. We have a lateral epicondyle on the outside, but you can see that there's an articular capsule. Remember, there is a joint capsule. This is a synovial fluid-filled joint. So there's an articular capsule that covers the lateral epicondyle of the humerus. So the medial one, if you're feeling on your own elbow, it's much more prominent, and you just have like a tiny amount of skin between that and the bony prominence. So much more firm to feel this on the inside of your elbow. Often it sticks out a little bit more just because the joint capsule does not cover it. As we're looking at these pictures, which I both love, we can see the radius here on this medial view. The radius is in the back. And this annular ligament, look at those fibers of the ligament, how they're traveling around, and they're perpendicular to the fibers of the articular capsule or joint capsule, as well as those ulnar collateral ligaments. Remember, there's different bands to the ulnar collateral ligament, but I'm just going to ask for you to know that there's the ulnar collateral ligament on the inside of the elbow, or the medial aspect, and the radial collateral ligament is this one here on the outside, or the lateral aspect. I will not ask you for the specific band names. When I look at the annular ligament, though, know that this encircles the head of the radius. Remember, the radial head is the thing up at the elbow, the most proximal aspect there. So really interesting how the fibers run this way, and they just hold it down because remember the radius at this joint, at the radiohumeral joint, is the one that causes forearm pronation and supination. So we look here, the radius articulating here. There's this video here, YouTube video, that I will post, elbow anatomy tutorial. This is a really good one. I want you guys to review this as well. I am not going to circle back to the elbow in class, so please do spend the 7.5 almost minutes of reviewing this just so you really have the elbow down. But as we're looking at the radius ulnar and humerus coming together, we do see that articular cartilage exactly the same as in the knee. And remember, this is the type of cartilage that's really slippery, about 1/4 of an inch thick, and it's meant for the articulations to glide smoothly on it. So again, we've got the flexion extension that occurs at the ulnar humeral joint, and that's where you really see that olecranon process in the back. But then that the radiohumeral joint here moves in a circular way for the forearm pronation and supination. Important thing there. You can see our ligaments here. So we've got the 2 collateral ligaments on the side, and then that annular ligament that really encircles around the radius, goes all the way around even to the posterior aspect, and just holds it down onto the ulna there, which allows for that circular motion as it articulates with the humerus above. So important ligament there, and good to see how the fibers run different and how that changes its function. There's the joint capsule on top. We've got synovial fluid under that joint capsule. There's a nice picture in the back there too, where you see that it runs all the way around, and how we have that capsule on all sides. Medial collateral ligament on the side, lateral collateral on that side, and then you've got your annular ligament right there. So again, check out this video all the way through. It does a nice job of talking about the elbow completely. So I do want you to make sure you have a good grasp on that. But that is the most important thing that I would like to point out about the structures of the forearm there. Let's close this one out. The other thing that we talked about that I do want to make sure that you've got a good handle on is the brachial plexus. Remember, brachial plexus originates as nerve roots from C5, cervical vertebrae 5, to T1, thoracic 1, C5 to T1. And we've got these big roots coming off, which are nerves, and they bundle down. They dip below the clavicle, so there's the clavicle coming here. They go under that clavicle and still are bunching here. Remember to review what they're called at different parts as far as divisions, branches, roots. We did that in class. Make sure you review that. And then we come down to this area, which is called the axilla, or the layperson terminology is also called the armpit. From here, we see it go into all these branches: ulnar nerve, median nerve, radial nerve. We have the axillary nerve, kind of loops around. Remember, that innervates the deltoid muscles. And we also have some other nerve branches that come out here. We've got the dorsal scapular, long thoracic, and that goes to our serratus anterior. So we've got some that go down the front, some that go down the back, and just really hit all of those little nerves all over the place. I would suggest that when you're studying, that you know the nerve innervation to all the muscles. So we've covered a great deal of muscles in both the shoulder complex as well as the forearm, and eventually we will get down to the wrist and hand. So the main nerves: the axillary nerve, thoracodorsal, suprascapular, pectoral, long thoracic, radial, ulnar, median. Know what muscle is innervated by which of those nerves. Very important. From there, I'm going to post this. I wanted to reference the test, guys, and what I really want you to get out of this class. So it's not just studying for the test, but what I really want you to know from this class is that application component. You should know, based on how the body is structured and where the lines of pull are going for the different muscles, you should be able to figure out their action. So knowing the origin and insertion is very helpful because now you know bony-wise what you're talking about with those origin and insertion, and that should naturally lead to you figuring out the action. But knowing origin, action, innervation, origin, insertion, action, and innervation, but knowing all those for all these muscles, it will be very important. It's heavy on the test. It's an important part of this actual class. So I do want you to know that. Some of the muscles that we talked about, like the deltoid is a good example. We have 3 deltoid areas, the anterior, the middle, and the posterior deltoid. So, you should know that it has those 3 areas, but let's say I said, and the deltoid is primarily responsible, it's their main shoulder AB abductor. And if I said, well, which part of the deltoid is involved with shoulder abduction, but it also assists with shoulder flexion? You should know that the part of the deltoid that assists with that would be the one on the front of the shoulder, because it's going to flex the shoulder as it contracts. So it would be the anterior deltoid would assist with shoulder flexion, whereas the posterior deltoid would assist with shoulder extension as well as abduction, just like the rest of them do. So I would like you to be able to connect the dots with those kind of things. But like I said, the muscles are going to be really important for this test, knowing origin, insertion, innervation, action. And this PowerPoint that I found here, I will post. I did not make this PowerPoint. I found it on a Google search. But what I like is, I think your trail guide text actually does a really nice job of putting the little boxes in of all the muscles and all of the associated things that are important. But this PowerPoint that I found is unique in that you've just got them all side by side in a nice organized way. Disclaimer, I have not looked at this in great detail, so make sure that you check it with your trail guide to make sure that they've got all the correct things. It goes all the way down into the muscles of the hand, those that extend the hand and wrist, as well as the fingers. So this would be an inclusive upper extremity guide as to all the muscles. Again, I will post that on Blackboard. Could be a good way to review that, but proceed with caution. The last thing that I want to talk about for the upper extremity, to include the shoulder complex as well as the elbow, and then I'll do another video for the wrist and hand later on, is one different thing that I do on the test this time is you'll have to know just straight, what is the action of this muscle, or what muscle flexes the elbow, supinates the forearm. That's the bicep brachii. Well, in addition to knowing just straight memorization of the action of the muscles, I'm going to ask you specifically what muscles might be trained in common exercises. So we see from reviewing some of these actions, and we talked about this in class, that a lot have very similar actions. You might have 3 different muscles that all work to horizontally abduct or abduct the glenohumeral joint. So if I was doing a reverse fly exercise, which is a glenohumeral horizontal abduction motion, what muscles would all be involved? So this takes it to a different level of applying it, of knowing, okay, these are all muscles that have a similar line of pull. So knowing those origins actions and then being able to say, okay, they all would have some kind of pull when I do that motion. Another example, so let's look at the bench press. So that's a starting position, and he's going to push up so that that bar is raised and those elbows are fully extended. So I might say, what muscles are trained in a bench press exercise? And this would be glenohumeral horizontal adduction, adduction, and elbow extension. So that would be the pectoralis major is going to be working primarily, and you can see that pectoralis tendon right here. The anterior deltoid, remember that's going to have some role, as well as we've got to extend at the elbow. Well, that's a tricep brachii. So those muscles would all be involved. I imagine that this would be set up where on a test you would get the exercise name. So I'd say, okay, what muscles are being used in the bench press? But then I will give you the actual motion. So I'll say elbow extension, glenohumeral adduction, and I would assume also these would be in a multiple choice format where you will see a group of the muscles all together and decide which ones would all be used for that particular exercise. But there are several times that you might be asked something like this. Again, taking it a step further, you know all this stuff, but now it's just putting everything together and taking the separate muscles for the origin, insertion, action, and innervation, and now saying, okay, the body's working as a system. So within that system, which ones are working to do similar actions for similar types of movements. Hopefully that makes sense. I think that just about summarizes the things to heavily focus on for this next exam, and hopefully you have a better understanding. Remember, we've got the two joints at the elbow. The ulnar humeral is our typical hinge joint. That's our true elbow joint, which allows for flexion extension. And then we've got the radio humeral joint, which is the forearm supination pronation joint, and that one is that spinning pivot joint. Up at the shoulder complex, remember we have the four joints, the sternoclavicular, that's right there at the chest, the acromioclavicular, distal part of the clavicle, and the glenohumeral, that's our ball and socket joint, and then the scapulothoracic. Remember, the scapulothoracic is not considered a true joint. It's a false joint as it has no ligaments. So those are things to keep in mind as you're reviewing. Hopefully this helped you guys. Again, take a look at that PowerPoint on Blackboard that organizes the muscles if you think that's a good way for you to review those. And do watch that 7-minute video on the elbow. That's an important one. I'm not going to circle back to the elbow next week as we'll be moving on right away to the hand. All right, let me know if you have questions. Talk to you guys soon.